Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hi, everybody. Welcome back to the Medical Collective. I'm Dr. Keisha Davis, your pathologist, the doctor's doctor, and I'm here to explain the science behind the headlines so everybody can understand it. Now, this past week, I have been busy. I had the opportunity to join Don Lemon's show and speak with TMZ about the autopsy process. And one thing became very clear from those conversations. People are genuinely curious about how autopsies work. That can I agree. And that's encouraging. It truly is. When people become interested in science and medicine, that means people want to improve and change. But I realized something. Most people have never actually been explained what a pathologist is or how pathologists perform autopsies. So today, I'm not here to discuss a particular case by any means. I'm not here to speculate about an ongoing investigation. High-profile cases will come and go, but I want to explain the process. So the next time that you hear an autopsy discussed in the news, you'll understand what's happening behind the scenes. Now, let me clarify one thing before we start. I'm an anatomic and clinical pathologist. I'm not a forensic pathologist. I did not do that specialty training for fellowship. And a forensic pathologist is an additional subspecialty. So they went to medical school, like me, medical doctors. They do a residency, whether it's AP and CP or just AP, which is anatomic pathology. So they're able to do things in surgical pathology, right? When something comes into the lab to diagnose cancer, a tissue specimen, they're able to do things like that. And clinical pathology is a side where you deal with the laboratory medicine, okay? So forensic pathologists have done their residency, and then they do a year or more additional in forensic pathology training. That's unique to investigate deaths that fall under the jurisdiction of a medical examiner or a coroner. Now, many of the principles that I'll talk about today are broad, and they really apply to all of pathology. But when it comes to scene investigation, manner of death, and medical legal investigations, that's the expertise of our forensic pathology colleagues. So shout out to them. One thing you'll probably notice throughout the episode today is a theme. And I'm going to be very careful with my wording. And that's intentional. As a pathologist, I have learned that over the years. Pathologists are trained not to jump to conclusions. You will hear us use phrases like consistent with, and our doctor friends love that, suggestive of, cannot exclude, clinical correlation recommended, which Dr. Sharon rolls her eyes, or based on the available evidence. Some people mistake that for uncertainty, but it's scientific precision because nothing is ever 100%, right? Our job is not to make the evidence fit our opinion by any means. Our job is to make our opinions fit the evidence. You see the difference? So I often describe autopsy as someone's final medical story. It's the death story. It's so important. And my responsibility and other pathologists' responsibility is to read that story as accurately, objectively, and complete as possible. And that's why today's episode is called What an Autopsy Can and Cannot Tell Us, because one finding is never the whole story. So let's get going, everybody. And one of the biggest misconceptions about pathology is that we start with answers. We don't. We start with questions. If you've ever been in science and laboratory, and you remember when you had the hypothesis, the scientific, you had to go through the whole scientific process. You started with a hypothesis. That's the same thing. We start with questions or what we believe may be true, but we have to answer them based on all the evidence that we have. That's how we do it. So, let's start with the biggest question people ask. What can an autopsy tell us? I mean, that's a valid question. And let's get into it in this first part. What the autopsy can and can't tell us is really an important thing. I think about one thing that movies do very well. They make forensic science sound and look so cool. And it is. To be honest, it is. The way they have the people in the lab, these questions being answered, but something they have not done as well as you see them in the lab, maybe with the toxicology, is they don't answer the autopsy process and explain it. And many people think an autopsy answers every question. How did this person unalive? Who unalived this person? And sometimes they can answer most of the questions, but unfortunately, even with some of the things in the news right now, it cannot always. And it doesn't happen right away. Understanding the difference is so important. And that's why I want to make sure that we understand that, okay? This is one thing. An autopsy is the most comprehensive medical examination we can perform. And I'm going to tell you why. When a decedent comes into the autopsy room, whether it's a medical autopsy, which most anatomic pathologists can perform, someone unalives in the hospital, and for other reasons, or the family requests it, an autopsy is done, they have medical issues, we either confirm those or maybe find other things that we weren't expecting, right? Or there is a medical-legal investigation, and then a forensic pathologist looks at it. But at the end of the day, we're thorough. We have lots of information from the family and from the hospital if it's a hospital autopsy. And when I tell you, when I started, we had paper charts. And not just one chart. I remember one autopsy that had 3 or 4 paper charts this thick. And for those that can't see, imagine like half the size of a ruler thick, 3 or 4 of those full of paper, and you have to read over them before you start, not all of them, but summarize to get information about what you should be looking for, right? That's the first thing we do. That's the first thing. Now, the second thing we do is we know we're trying to find 2 things, right? We want to find the cause of death and the manner of death. Those are the things. And we start the process with that. Now, before I get into the autopsy process, I want to say with the manner of death. The manner of death is the way that someone unalived. Is it natural? Is it an accident, suicide, homicide, or undetermined in some medical legal cases? And that happens. Also, what is the cause of death? Is there trauma? Are there internal injuries that weren't apparent externally? Are there natural conditions like heart disease, infections, strokes in the brain, a cancer, a pulmonary embolus, an aneurysm, and many other conditions? We can do that. Now, I'm going to start with some of the things that we do. We collect information. When we first get the decedent, we are taking pictures. We are looking at everything. If somebody was in the hospital for a long time and maybe had an IV and had multiple things, all of those devices are accounted for. If the person had an accident, had many bruises, the bruises are documented. All of them are documented. If someone had a gunshot wound, the size of them, whether it's an entrance or exit wound, pictures are taken. Significant pictures are taken of the external. That's just the external, from the head to the toe. Then we collect specimens. Every case, the standard of care, especially for forensic cases, is to do toxicology. So when people ask, why is tox done? It's not to say that someone was on something. Toxicology is standard, and many things can be shown with that, right? Exposure to things we didn't expect, but it's important to close the story. That's why toxicology, sometimes from the eye fluid, which is the vitreous, the urine is collected, blood, and liver for toxicology. So important. Then when the body is opened, all of the organs are examined. We look at them, The heart, dissect the vessels of the heart. The lung, go down the airways and look in them. If someone has a drowning, we look for changes like fluid actually in the lungs and the alveolar spaces, maybe some frothy material in the mouth or nasal passageway. If someone had taken some things in the stomach contents, we can find things there. In the liver, slice the organs very thinly to look for any changes. And then we take sections. That's the microscopic examination, which is so important. We collect things for microscopic examination so that later under the microscope, some things are found microscopically, and you all know that from many stories I have with you. It's so important. And for infection, microbiology, things are taken and cultures and tests are done to make sure. And if there's ever a worry about someone having an undiagnosed syndrome, genetic testing can be done when it's appropriate. So it's all part of it. And other laboratory studies are done too. So an autopsy is not just looking at the organs, right? It's not. It's medicine. It's the art of medicine, because now we have to take all of our skills and apply them to a real life situation. Yeah, including what I say, the parts of pathology, laboratory, histology, toxicology, sometimes genetics, and then the history, right? The investigation for a forensic pathologist, if they go to the scene and look at the scene, all of that comes together. So that all makes sense, but let me tell you sometimes where people get confused. They think that once this autopsy is done, right, the report should come out right away, first of all. That doesn't happen. That the mystery's solved. Wait for the autopsy and then we'll know what happened. What if I tell you that does not happen all the time? An autopsy can answer medical questions and we can have findings. We can tell you what we see. But what if I told you that one finding could have multiple stories? Multiple stories can lead to the same thing. That's how we cannot answer those medical questions. And it doesn't always answer legal questions. And let me give you an example. So an autopsy can determine how somebody died medically, but it cannot determine who was responsible for it. Say, for instance, even if the person did drown, were people watching? Where did someone may have immersed the person in a way, maybe with the hand or head, to where we don't have any autopsy findings? We don't see anything happen around the neck area. We don't see any contusions on the body. So this still doesn't answer that. Intent. Why did said person do it, if someone did it, or someone self-harm? What was their motive? What happened before? What were they doing before the death? Every event leading up to the death is not answered by the autopsy. And that's where law enforcement comes into play. Scene investigation comes into play. Witnesses and their interviews, also important. Digital evidence. These cell phones that we love so much can do so much. Forensic reconstruction. Now, this is where my law friends, this is where medicine and law overlap, but they're not the same thing. They're not, but sometimes we have to have conversations together to get the final answer. The death story. So one way I think about autopsy is this, and I always say this, it is the death story. It is as important as your life story. Everybody has a medical story, a history. And unfortunately, I know we hate this. The final chapter, sometimes we want to know the final chapter, and sometimes it's not what we want it or expect it to be. But at the end of the day, it's still the final chapter. It's still the answer. And it confirms everything sometimes that physicians expected or suspected, that someone had an infection, they unalived, and sometimes it changes what everyone thought happened. And this is why I go back to why doctors and pathologists in particular are so careful with our words on our reports, because it takes one time to humble yourself and to end up thinking what you were so sure, oh yeah, this is cancer, this is 100% off a little biopsy. And when the final total specimen comes out, you're humbled to find out you were wrong. You were wrong. So everything that we thought, we're so sure this is what it is. And sometimes even your colleagues, everybody's concurring together. And And the story changes. The story changes. So it can answer questions families have carried for years. I think that's important too. Maybe you were like, something was wrong with them, but they would never go to the doctor, right? So it doesn't necessarily have to be something about homicide or suicide. And you want to find out what they had. Or, you know what? Their uncle, their sister, all other relatives had something similar to this. Can you find out what it is? So now we're identifying a hereditary disease that can affect other family members that are surviving. So now they know the answer. And sometimes it even changes public health. I always talk about the slats on the crib. When, again, forensic pathologists, have meetings and they get together and they assess, okay, in this jurisdiction or in this area, we're seeing children or people unalive from this. What can we do to change legislation or look to make sure this doesn't happen? Slats in the cribs was one of them. And so that's why the link, the distance between the slats was ordered to be less so that babies did not get caught in there. It's so important. And changing legislation is one of the many things that the death story can do. It even changes hospital policies. Even hospital policies, yes. And sometimes it simply provides a family with an answer they needed. How many of us live wanting to know closure? The death story can do that. And that's why the work of pathologists and forensic pathologists matters. And that's why I salute them every day. I appreciate you all. I truly do. Now, medicine is not CSI. One thing television has taught people is that every mystery gets solved in 43 minutes? 43? And some of now these AI stories, it gets solved in about 20 or less. But real life does not work that way. Sometimes the findings are obvious, like a recent autopsy that was done, and people knew right away that someone had an aortic dissection, but it does not always happen like that. It can be subtle changes. And when there's subtle changes, just like the redness on the back of a head of what's recently in the news, because the redness is there, but the skin underneath doesn't necessarily show a puncture wound or an abrasion or something. The bone underneath is not fractured, so you're in a gray zone. Did somebody cause this change on the back of the head, or was this postmortem? That's where there's a gray zone. We can't answer it. And even in the cases that there are multiple diseases present, you're wanting to know which one truly caused it, you may never actually have the specific answer to that. And also, trauma and natural disease can exist together. Somebody can unalive from a car accident, but you find out they were living with a tumor. And it's still important to know that because that's your family member, your loved one's death story. So important. Even sometimes people unalive and there's no specific findings. That can happen too. And that's hard for people to understand. A thorough autopsy can still leave some questions unanswered. I want you guys to understand that. And it doesn't mean always that the pathologist missed something, especially after all the documentation I just told you. It means biology doesn't always give us every answer or a specific answer. Yeah. Now, as we move throughout this conversation, one of the things that pathology has taught me over the years is to become comfortable saying, you know what it is? Not that I know it, that I need more information, that I am not entirely sure. That does not make you weak. 15 to 16 years of practicing medicine, and I do not believe I'm weak, and it's because I know when to defer. It's the same reason why I have something called the Medical Collective podcast, because I believe I am stronger with a bunch of amazing doctors that have their own strengths and expertise. That makes me careful. Right? That makes me careful, realizing my own limitations. Now, early on, I've had cases where I thought I knew exactly what was going on. I thought this was benign, and I have been humbled. I've been humbled. This is also why I believe in showing to other people, not necessarily getting a second consultation or what people say a second review. It's that before I sign out a case, I show it to other doctors. And even with cancer or certain biopsies, a lot of places, that's part of the rule, the standard is to show it to a second pathologist before you sign it out. But even in some of the most benign things, which is why we have review, where a certain percentage of cases are reviewed, we may miss something. But even if we don't miss it, I can come to a case thinking I know what's going on. I look under the microscope and I'm blown away. Or the physician. I had physicians that are like, oh yeah, we just sent you this GI biopsy. And I'm like, it's cancer. And they're like, but everything looks so normal. They're even taken by surprise. Yeah, it happens. And especially what really helps is when another piece of clinical history comes in. Somebody's getting a gastric biopsy or a small intestine biopsy, and there's no history. And then when I call back, I find out the patient has a history. And when I'm looking, because I had this nudging, these tiny little cells percolating through, and it's metastatic breast cancer. Yeah. So that's why it's so important to get the clues. For those that love watching mysteries, or you remember Nancy Drew, right? Alfred Hitchcock. They start out making you really think one way, right? And then right towards the end, you're like, oh my gosh, I was missing that. And now the case looks totally different. Looks totally different. So even when we're looking, imagine we're listening to these stories from the news and from TikTok and social media influencers, and it's skewing you to think one way. But what if we're not getting the whole story? Yeah, that's why when you hear doctors say things, or when I did on Don Lemon, is I'm very careful with my words, because I've learned too many times that not everything is what it seems. Never fall in love with your first impression. Well, listen, unless it's a person. Like, I remember when I first met my husband, he will say that I came and introduced myself to him, but that's not the case. But sometimes the first impressions are good. It's good to make a first impression, y'all, but don't become convinced by it. And you all know a lot of you by meeting people online. Keep asking questions. Keep gathering the evidence that you need. So important. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Here's where people get confused. An autopsy is not designed to answer every question. It's designed to answer the questions gathered in the report, right? Answer the questions the evidence can support. That's all that we can do. Now, I want to bring us to what I think is what I know is the most important lesson of today's episode. Because whether we're talking about an autopsy or a biopsy, because we hear about that too, people in their biopsies, or laboratory medicine in general, one finding is almost never enough. Never enough. So please remember that. Remember that when you are even on social media, now you know to question people. And this is why one finding is never the whole story. Because we've answered this question about what can an autopsy tell us, or a biopsy. So let's talk about something that is more important as we even conduct ourselves on social media and propagate stories that may not be true. Let me tell you how pathologists think. We do not look for one thing as the answer. It really is not about one finding that's the answer. The question that we ask is important. This is where people get confused. I will hear that, oh my gosh, there's one finding in the autopsy report. I saw the redness on the head. But that in itself doesn't mean much. And that's where, again, as pathologists, we're careful to say, well, what I see is redness on the head. What happened or what exactly that is, there's not enough information to tell from that one finding. One toxicology result, well, someone had a elevated blood alcohol level. That doesn't mean that that's the reason why they unalived. Oh, I saw a fracture. Well, how old? Was it old fracture? One area of hemorrhage. Does not mean enough on its own. That's not how we work. Every finding has to fit with every other finding. Like a puzzle piece. The puzzles, I used to love doing the box puzzles, and they have to fit together right. Even it can look right, it has to fit right. And we have to decide what those findings mean. And also we have to wait. Another thing, for instance, hemorrhage. Hemorrhage is not always a bruise. This is where people get it conflicted. Okay, so you've seen or heard about people saying the photographs show a red or purple discoloration, and immediately people say, oh, that's a bruise, they were bruised. What if I told you that sometimes things can happen post-mortem that can make these changes? Yeah. A true bruise means that blood leaked into the tissues while circulation was occurring. So the person was alive. And under the microscope, we can see blood dissecting through the tissue. And if it was like older, we can see changes, right? There's changes that happen over time with a bruise, inflammatory response and such. But after death, blood can also move. Gravity takes over, and you see what we call postmortem lividity or livor mortis. That's where blood settles in dependent portions of the body. And as decomposition occurs, tissues, blood vessels begin to break down, creating color changes. And those can also be misinterpreted if viewed without context, or if you are not an expert in said field. So when someone says that red area proves trauma, as a pathologist, I ask, is this true hemorrhage? Who says that it is? Is this post-mortem changes? Is it vascular congestion? Those are the questions that you should be asking, or listening to someone that explains it in this way. And then also, what does the scene show? What happened at the scene? What is the story? So it doesn't mean the same thing. These findings can be due to multiple causes. Same thing with fractures. If an autopsy shows a fracture of the bone, people want to know, when did it happen? Did you know we cannot time all of these processes sometimes? For instance, what if it was in the chest area, the ribs? Did the person have CPR? Are these old fractures from another injury? Those are important things. Is there hemorrhage associated with the bone fracture? Do we see healing? And those things we can see under the microscope. If there's healing of the bone, we see changes, and that means you were alive at the time to show that the fracture started to repair itself. So important. And then again, does the scene corroborate our findings? Do they fit together? That's how you hear when lawyers have this story together. That has to fit everything. Sometimes it does not fit. Now, let me even get to toxicology, because that's another one. A lot of people, toxicology is not always the answer, and it's not straightforward. First of all, there are independent labs or labs that, depending on the jurisdiction, where when it's a forensic case, that's where they're sent for toxicology. And yes, it can take sometimes just 2 weeks, but other times it can take 6 weeks, 8 weeks, depending on it. And then you hear from, television. Television will show you this is what the toxicology is pending, then all of a sudden there's this answer, and they're like, oh, that's the answer. Now, the reason why we don't complete a report until toxicology is back, you know why? Just in case. Even if we have everything pointing to something, you have not completed the circle. You have not completed the entire story if you are missing a link. And the standard of care in doing an autopsy and forensic pathology is to do the toxicology. So you have to wait. You can't miss a step. I'm telling you, as someone, when you work in a field, just imagine if you're cooking and that one day you decide, I'm not going to wash my hands, and people end up getting E. coli infection. It's the same thing. We have a process and we follow the process for these reasons. Also, when they get the tox report, they think it's just sitting. There's a paper sitting with one answer on it. No, it's a conglomerate of tests sometimes. It's not simple saying, was a drug present? It's not. The question they're asking is, which medication or which drug? How much of it? Right? The amount of it. Was it prescribed? So now we got to go back and see, was this a prescribed medication? Was it therapeutic? Was it toxic? Was it even an element or something? Could it have contributed to death? That's another thing. Just because we're doing tox doesn't mean it contributes to the death. Could it have been an incidental finding? Right. Another thing, alcohol. Everyone's like wondering about cases. Oh my gosh, was there alcohol? Did they have above the legal limit of alcohol? Why can't they just repeat the toxicology? Because when it comes to alcohol, the more the body decomposes, there can be a breakdown to where the body, the bacteria produces alcohol. So there could be a falsified elevated level of blood alcohol, but it's due to decomp. So now we have to interpret that. And there's not a chart, y'all, that you can follow. Forensic pathologists know this. That's why they don't rely just on that number at all. Yeah. What pathologists are looking at is, when was the specimen tested? What kind? Was it vitreous? Was it blood? What was the condition of the body? Those are the important questions. Was there decomposition? And do our toxicology results fit our autopsy? Does it fit the scene? Does it fit the medical history of this individual? And do know there's a chain of command at these places. We all have the right, if we're concerned or questioning something, right, especially with the trust of medicine, to wonder that. But don't go down a rabbit hole where you're questioning every single thing. Wait until the results come out. And then, again, second opinion, because sometimes there can be a difference in opinion. But again, toxicology alone is not going to be the answer. It's a lab test. It's a lab result. And we've talked about that before. It's part of the story. And even if it doesn't fit the story, it's just like our story. Sometimes we do stuff that does not make sense, but it's still part of our story. Another quick one is drowning. People often think if someone drowned, what? The lungs will prove it. We're waiting on the lungs. Sometimes they do show the changes that I talked about earlier, but sometimes they do not. It's just like a lot of cancers and things we diagnose. They can be textbook cases, seeing the lung, seeing the water in the lungs, in the alveolar spaces. But that does not always happen that way. I have learned that many, many times. So a diagnosis of drowning depends on the scene investigation, circumstances, the medical history, too, toxicology, all of these things. So it's kind of like stepping stones. This helps, this does not. This kind of helps, this does not support. And you have to exclude other causes of death too. Yeah, it's like a Nancy Drew. There's not one dramatic clue, unfortunately, that's going to come and answer everything. So sometimes the most important finding is the one you didn't find. Did you think about that? And I love this lesson because it applies to all pathology. No skull fracture, no internal hemorrhage. Well, we cannot say that person was hit, said there. No significant coronary artery disease. Well, probably didn't die from atherosclerosis or heart disease or a heart attack. No pulmonary embolus. Well, we can scratch that off as a possible cause of death. No infection. They probably didn't die from sepsis. Those are negative findings, but they're not failures. They are clues. They're clues that help us kind of go away and limit or narrow our differential diagnosis. That is important. We're narrowing our differential diagnosis. One of the reasons that I love pathology again is it keeps me curious. And a lot of people are getting curious right now in the news. But one thing we need to remember is to be humble. And pathology has kept me humble. It keeps me on my toes, of course, because I'm always ready to see what's next behind the corner. Every time I think I know where a case is going, something reminds me to slow down. Slow down, take a deep breath. I may go when I'm looking at slides and take a break just to to clear my mind and refocus. Yeah, and ask more questions. I may need to gather another piece of evidence. And this is also why autopsies and the death story should not be rushed. You want to rush what an expert's doing, and it may compromise their findings, the report. And, we need to challenge each other and ourselves. And that's not uncertainty. That's good science. So what people are practicing and what pathologists are practicing is good science. And unfortunately, it can be frustrating because it's not fitting the Nancy Drew or the CSI episode. So let me tell you this. Every finding deserves another question. You want to get closer to the truth, right? You want to narrow down your differential. And that's what the death story in pathology is doing. Okay? So let's close with this. How do we put the entire story together? And that's where the rest of the investigation is. Now, I briefly talked about the clinical history, right? So important. We get many cases, and I will look at it blindly, meaning I'll look at it without knowing anything from the patient's name. But you know what I want to go back to is the clinical history. And I call the doctor. That is what the forensic pathologist will do too. Speak to the family if they were in the hospital. Who were they around? What was their life like? What was their story? What type of person were they? Were they taking medications? Yeah, it doesn't tell us the answer, but with the history, we can ask better questions too. We can get an understanding of things. And for forensic pathology, you have to go to the scene sometimes. Where did it happen? What's happening around the scene? Even during COVID-19, one of the forensic pathologists was telling me they would get a lot of stories about people that died at home. But the reason they had to go to the home, it was, an unknown cause, but they died from COVID. And they would see at the scene cold medicine next to the bed. They were trying to treat themselves and all that. And another part is talking to emergency responders if they were there, looking at medical records, talking to people that were around at the time, checking text messages, all that stuff. Also important. What else was nearby? Yeah. So these are the things that are part of the investigation that help put it all together, right? With a neat bow, should we say. And then briefly about microscopy. When I look under the microscope or forensic pathologist, things can be found microscopically that were not expected, grossly. So that's why it's important to do it. Small tissue samples are processed. It may take a few days to wait on that. And the pathologist looks, just like in surgical pathology, at those tissues. Now, because this is a death case, there can be what we call autolysis. It's more difficult to look at it. Tissues and things have started to break down, so you do have to look through that artifact. But it still helps answer the question. If someone had a heart attack and at home, right, still suspicious, we'll see the changes of that. We'll see the changes of that under the microscope. So important. Now, one last thing about toxicology. Since it seems to be a lot of people who are concerned about it, even if a toxicology report comes back positive, they do interpret it based on the other findings, right? So again, that's still part of pathology, the toxicology, the autopsy, the microscopy in the autopsy, the prescription history, the clinical history. So you've got a lot of different people, and that's why it's important for all of us to gather the information correctly, take pictures correctly. The laboratory is following the standards that they're supposed to. So we do have correct information. I want to make sure I normalize that, right? We still have to have correct information. We're not getting things that are not correct. That's important. We're practicing good medicine. And if we need a subspecialist, we will. If they need a second opinion, a forensic pathologist will consult another pathologist. Medicine has always been collaborative. It's not competitive. I'm not competing, because at the end of the day, what are we trying to do? Either help a patient, save a patient, or help a family provide closure. So second opinions are important. In a lot of these cases, people don't understand that a family can get a second opinion. It's important. There are also resources that can help with that. And I don't think a second opinion means that the first person cannot be trusted. That's not what it means. It means that you want to make sure that you are on the right path. Because remember, even the best of us can be confused. There have been cases where someone, by a first pathologist, was told it was maybe a natural cause of death or undetermined, and then the second autopsy changed the course and they interpreted it as a homicide or something else. So two people can have different interpretations, and that's unfortunately how science works, because these are not always textbook, and it doesn't mean that one person intentionally did this. I want that to be clear. Right. I want that to be clear. And I did this episode because the things I'm talking about apply to all of science. They apply to everyday life. We're living in a time where we see one headline, one photograph, and we run with it. And this is the time for us to step back and understand what? It's bigger than that. Like our children may say, Mama, it's not what you think, right? So let's slow down, all of us. We could learn from our children. Let's slow down. Let's ask more questions. Let's start learning the facts first, right? About how things operate before we assume it's so simple, because it's not. And the best pathologists aren't the ones who jump to conclusions. They're the ones willing to ask more questions before they do and know their limitations. And I'll be the first one. I am good about delegating. So we spend all this time about autopsies. I don't want to leave with a few things that may surprise even other physicians. And you. They may or may not surprise you. And there are things that people don't realize about autopsies. Just a few. One of them that I want to start with, and it's not trivia, it's just things I want to tell you all in general. And a lot of them may be nuanced. Toxicology isn't just positive or negative. There are actually values that come with this. Okay, that's the first one I want to share with you guys. The next one of the biggest things is that maybe toxicology, the results are forged, or they can be this. There's a process to it. There are people in there. There's an assembly line to doing these reports, okay? I want people to understand that. And alcohol is one of the most complicated substances to interpret. You got that, right? That's one thing. Alcohol concentrations can change over time. So that's why we don't look at those reports in a vacuum. And we ask about the collection that I mentioned before. A next one that I wanted to talk about. One number by itself does not mean much. Okay, another one. Red does not mean trauma. It does not mean bruise. You guys got that now, right? Discoloration can be postmortem. It can be a lot of things. It means vascular, unless there was some red from another thing, but gravity is where blood collects. Because of gravity, blood collects, and postmortem, it can cause that. You guys got that. So we do a more in-depth investigation to find out where. Another one. Sometimes the most important finding is the one that's not there. And I'm just going to allow you guys to think about that. Sometimes the most important finding is the one that's not there, because they narrow the possibilities. And I hope you go with that. You're going to know more than many know. Another one. A second autopsy does not erase the first. Okay? It does not. It does not replace the first one. It's more information. The more the better, right? The more the merrier, the more the better. That's another eye looking at a case from a different way. If it's going to help a patient, a loved one, let's do it. If it's going to help a legal case, second opinions are good. You all, second opinions are good. Yeah. So the hardest thing is that we may not get the answer we want, or we may not even get a definitive answer. I want people to understand that and go away with that. I also want you to know a question a lot of us may ask. What do we do now, Dr. Keisha? What can I do? You can spread correct information. I always talk about that. Number two, you can know that there's resources like the Autopsy Initiative, the Colin Kaepernick Autopsy Initiative, that dived really big into this. The Colin Kaepernick Autopsy Initiative does accept donations, does accept support, is looking for people in different fields to help with it. And one of the reasons I continue to do this podcast is because I saw people like their work and people don't know about it. And so I want you all to know about things that many don't know about. So pathology keeps me humble. We all need to have a little bit of humble pie and ask more questions. So every time you see something, where is this going? What does this mean? Let me step back. Let me go look at some experts on this and see, right? So all of you, ask more questions, be empowered. Until next time, I appreciate you all for being here. Thank you. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.